Always wanted to be a nurse. Ever since I was a little girl, always wanted to be a nurse, and that came true in 1974, and I have been active in my profession ever since. But as I watched managed care set in, and it used to be more holistic. You know, your general practitioner would deliver the baby and take care of grandma, come to the house, do house visits. There was no insurance company watching and scrutinizing every little thing that the doctors, all their decisions and whatnot. So being in the trenches for all those years, I just watched the way it was slowly changing. And now the insurance companies were deciding when to kick people out, even when they weren't ready to go. And I always had this desire to do something. I kind of knew what holistic meant, which means body, mind, spirit. Like you're treating the whole person. You're not just treating that thing on their foot. You're treating everything, including their emotions. I just didn't know how I was going to get there, but I put an intention out. And Wayne Dyer wrote a book a while back. It's called The Power of Intention. And the title is How to Co-Create Your World Your Way. Co-create. Co-create. So you're not really doing anything on your own. You're asking a power higher than yourself, what I call a universal life force. Call it God if you want. Ask for help and try to co-create. So somehow I kind of already knew that, but I didn't really understand it. I just figured, just give it time and trust, and you'll figure out a way how to move from just being a straight RN to some more of a person who could have a holistic practice. First thing I came across was IIN, the school where Leslie went, Institute for Integrative Nutrition. And it was all kind of coincidental how I was able to afford it and get there. And it was in Manhattan once a month. I had a sublet apartment. It was like the highlight of my life. I was learning how to get some nutritional background, holistic nutrition, and initials after my name. So that was the first step. And then right around that time, someone put a book in my hand, a movie basically, DVD called The Secret. Have you ever seen it? Okay, so you know it's all about law of attraction. And I'd never heard that concept at all. And also right about that time, this is now 2006, 2007, I came across something called emotional freedom techniques. Now, I won't go into details, but I was having some trouble adjusting to something that was going on in my life. And all I only knew as a traditional psychiatric nurse was you take medications and talk to a counselor. But that didn't appeal to me. We talked about third eye. I intuitively knew there was something else that I could do to help myself get over this feeling. So I had subscribed to, Dr. McCullough? Okay, so I subscribed to him, learned a lot from him, and he would always refer to something called EFT. EFT, you could help your emotions, you could free yourself up. And that morning, it was August of 2006, I was desperate. I'm like, you know what? I'm skeptical, but I'm open-minded enough to just look at this and see if this is something I could learn and apply and have it work. So Dr. McCullough offered an 85-page manual for free. He was a Stanford engineer, brilliant man, and studied electrical stuff. So he understood the electronics of the body, and the energy system was the one system they didn't include in nursing school. I learned about every other system of the body, but they left out the energy system. But when you think about it, if I said, go get an EKG, what would you say? What would I be asking you to do? Electrical cardiogram, electrical encephalogram, electrical myelogram. So he started making sense to me, and his theory was if there's a disruption in your energy system, if you're not going with the flow of your energy system, you get blocked, you get stuck, you could get sick. If you don't know what to do with it, you could be deleterious effects to your body. So after those 85 pages, I read it cover to cover, and I went, this is worth a shot. So what it boiled down to was that, and I didn't know it, because he says, when you start, and you tap on meridian endpoints, they're all very specific. And he said, when you start tapping, you have to really tap on how you really feel. And the problem was, I was really angry about something, but my brain was saying, what are you angry about? We always doubt ourselves. what are you angry about? You shouldn't be angry. You shouldn't be, what are you upset about? So there was the conflict. There was how my true feelings were, and I was overriding them with my own thoughts.
So this system has really been around for
5,000 years.
Through many, many different cultures.
Yes.
So this is a neat way of approaching that body of knowledge with some techniques that are pretty simple to learn, is that right?
I have studied many techniques, Richard, and I always default back to EFT because it's easy, it's fast, it's quick, it's reliable. It doesn't hurt you, there's no side effects, and all it involves is your two fingers and learning where the points are and learning how to talk about how you really feel. I have seen so many, I've had hundreds of clients over the years.
So what are the applications for this? For doing what?
Anything. Adjustment reaction, grief, anger, fear, women who have just like been kicked out of the workforce. Before I was kicked out of the workforce, I used to treat these women, you know, that's they work there for 25 years and then they lose their jobs, worries about their children, marital conflicts, addictions, yes, that shows up.
So,
because
it's anything that really upsets the energetic
Yes.
flow within us, since we are
Yes.
energetic beings.
Yes, and over in China, they work on things like, again, someone mentioned Reiki, Qigong, those kind of practices that keep your energy flowing. They don't wait till they get sick, they prevent it. And that's the one thing about Western medicine. We just party like we're on the Titanic, and if it goes down, you better quickly run to a doctor and get a prescription. So this is completely the opposite, where you take care of your emotions. And a lot of people would rather say, oh, I have a migraine, than say, I really hate my husband. So what I call myself is an emotional excavator. I get down to the nitty-gritty, and I do it in a very non-judgmental. I meet people where they're at, and I very gently help them to start opening up. A lot of times they go, wow, I never really realized that before. And just start bringing up what's bothering them. Especially with diagnosis, you know, there's a doctor in Needham, Dr. Judith Swack. I don't know if you've heard of her. She's a biologist, she's a healer, and she did a diagnosis, she did a study, I think it was 12 years, called, she wrote a paper, she got published, called Diagnosis Shock. So when you get a diagnosis like you have cancer, I'm sorry, but here, take this lifeline and go see him. People are really thinking, oh my God, what's gonna happen to me? Am I gonna die? Is my hair gonna fall out? Am I gonna lose my job? It was like, what? That's what they're really thinking, but they're just told to don't worry, it'll be fine. So I like to look at myself as someone that can assist people and just getting down into how they really feel about things, because we're way too harsh on ourselves. We judge ourselves way too much, and we're not nice to ourselves. We have compassion for everybody else but ourselves.
Now let's talk about that. So what happens when we experience a trauma and we don't work our way through that in a healthy way? How do these things get locked into our body?
They do.
From a biology perspective?
Physiologically, they do.
Okay.
And I actually have a beautiful script that I've written called How to Unfreeze the Trauma, the Physiological Frozen Trauma. You're a little kid. People know fight or flight. What's fight or flight? Something happens. You either run like hell to save your life, right?
Or fight.
Or you fight. So that's the body gets all revved up to do that. It's a survival technique. And that's why these points are very specific, because each one of these points that we tap on relates to one, in Ayurvedic medicine, it relates to an organ that gets charged up. So we all know the heart beats faster, the lungs breathe, the liver spits out glycogen, the adrenal glands, even your skin changes, everything changes. So that's why Gary Craig is a genius, in that he put this together, one size fits all. So the traumas that happen in life, and they start from a very young age. When I work with people, I usually find we're going back to like your childhood and what happened to you and what role did you take on to strategize your way through. Because when you're little and they're big and you got some dysfunctional patterns, and most parents do, you got to figure out a way to handle that. And most people don't really understand what they're doing, but they're brilliant. Kids are brilliant. So say I cry and I get in trouble for crying. I'm never going to cry again. That's not safe. But if I cry and I get my way and get a cookie, I'll be a crier for the rest of my life. So these strategies, caretaking with women is a huge strategy. I had to please everybody. I had to be all things to all people. It was my responsibility to keep my family happy. Those are all little kids' brilliant ways to think, how do I get through this? Your first 7 years of your life are your formative years. And so we have stuff coming at us from all directions. There's school, there's religion, there's authority figures, there's the parents, there's the siblings, and there's a lot of stuff that's thrown our way. And we have to be resilient. Mm-hmm. We got to understand how to. But going back to the fight or flight, there's also a response that people don't talk about.
What's that?
That's the freeze. You know, possums know how to do that. Animals know how to do that. They play dead, they freeze. That's a survival technique too. So if you're that little boy in the schoolyard and here comes the bully, and you know you can't beat him, and you know he's going to beat you, and you can't run, you freeze. You just freeze that trauma. You freeze it in. Or a humiliation. You're speaking in front of the classroom, and you really don't want to be up there because you hate it. But you start to talk and read, and you make a crazy mistake, and you say a word completely wrong. And not only is the whole class making fun of you, the teachers rolling their eyes. Subconscious mind, which is always at work, is going to take a picture of that and store it so that you will never set yourself up again. Subconscious mind, you really need to understand how the subconscious mind works.
Yeah, thank you for saying that. That's a good segue for my next question. Can you talk about the tricky triad, which is what I call it, the relationship between trauma, the subconscious,
right,
and addictions?
Well, I mean, think about it. Addictions are always a solution. That's what I first learned when I started working with my mentor.
So how so?
So how so? Because they work.
Or so we think.
So we think.
Right.
But it provides some sort of a relief. Even if it's temporary, it still provides relief. And so that's kind of how addictions get started. They start out as a solution that works, like you said, time limited for a while. And they come in all sorts of packages. It's not just alcohol, drugs. Heroin's the big one right now, opioids, pain pills. We talked a little bit about this before, gambling.
Cell phones, et cetera, et
Oh
cetera.
my God, that's crazy. It's
Right.
getting crazier too.
Right.
Right, social media, sex, porn, it's all over the place, gambling, like I said. But there's something you get out of it. There's an upside, because when you think about it, if subconscious is 95% of your mind, and your conscious mind is only 5%, your conscious mind may very well say, you know what, I really need to quit smoking. It's $10 a pack. I can't smoke anywhere these days. I smell, da-da-da-da-da. There's somebody, they know they should stop, but then why can't they? Well, I'll wait till after New Year's, because they get some pleasure out of that cigarette. I used to smoke years ago, but it was not long lasting. But at the detox where I worked, I'd watch them go out on their smoke break, and they couldn't wait to get there. And I would watch their faces literally go, whew, like there's a pleasure. So this is where the subconscious mind gets a little kind of screwed up, because it's supposed to be for your protection, your safety, and security. That's its job. So while you and I are sitting here, we're not thinking about the pH of our blood or how fast our heart is beating. The subconscious mind has got it all, like a supercomputer, taking care of everything. But if the subconscious mind gets wind of the fact that you get some pleasure out of that habit, and it becomes your safety and your security, it's going to have a hard time releasing you from that.
So that's where.
Does that make sense?
Yeah, it does. So that, I mean, explains why there are so many different kinds of addictions. Though these addictions might be very different from one another,
Food.
they're all sort
Food
of
is huge.
feeding that subconscious desire.
Yeah. I've treated binge eaters. I had a woman, lovely woman. She came all the way from Connecticut twice a month. And she would plan her eating binges. She would drive around to the grocery stores, and she'd get her whole box of candy and cupcakes and ice cream, and then she'd wait until she was by herself, and she would eat it all. And then, of course, she'd be sick, and the next day. It's kind of like the same thing if you drink too much. You eat too much food, you get sick. But they keep doing it anyway, and it takes more and more of it. So she got help. She got help with doing the tapping. But her whole problem was a trauma that happened when she was quite young. And she accidentally hit a kid with a baseball, and I don't think he died, but I think he got totally brain injured from it. And then the father came over and, just did everything to put her down, and she turned to cookies. And her mom worked, so she had a lot of time to be by herself, and she would stand behind the curtains in her house and just eat the cookies. And that turned into a food addiction, that trauma, because those cookies provided some sort of a relief. I've worked with a lot of emotional eaters.
So it sounds like your role as a counselor is multifaceted.
Very much
You're
so.
offering a lot of different remedies and tools and counseling
Correct.
services. Okay.
That's why I didn't want to just stick with one. Many times it starts with nutrition. You're drinking 10 cups of coffee and you're putting 10 packs of sugar in that, and you tell me you're anxious. I have to look at that. Like, what are you eating? So I've kind of moved more towards the nutrition, away from the nutritional counseling, and more towards the energy healing, because I think that's the utmost of importance. Anyway, Judith Swack with her study, the diagnosis shock. So she divided people with cancer into 2 categories. And it didn't matter if they took traditional treatment or they went holistic. She had the tappers and the people who didn't address their emotions. And you can only imagine, people who addressed their fears and anxieties and their whole approach to what was going on, they had much better outcomes. And she's been published with that paper. So it's out there. It's called diagnosis shock. Because you do get shocked when you get a diagnosis. So if someone comes to me and it all started with a cancer diagnosis, I want to talk about that. I was like, where were you sitting? Do you remember where you're sitting? Do you remember what the doctor was wearing? Because with any kind of a trauma, you know 9/11, I know 9/11, you may not remember JFK's assassination, but anytime there's a trauma, that subconscious mind is going to record it. Okay, it's going to detailed, very detailed.
So let me ask this another way. Focusing on addictions, and there's so many that we talked about, it doesn't necessarily mean that a person is acting on a trauma
Not
or an
necessarily.
emotional deficit, right?
In many cases, it's there, buried around, but sometimes not. Sometimes it just starts out as a pleasure, but then it crosses the line. That's the tricky part. When does it stop being a pleasure? Some people can have a glass of wine and they're done. And other people, that one glass just leads to more and more and more and more. When does that happen? So I look at addictions almost like OCD, the obsession and the compulsion. The obsessing about it. Drug addicts tell me this all the time. First thing I do when I wake up in the morning, I think about where am I going to get my fix. I think about how I'm going to get my fix, how I'm going to hide it. It's all manipulative work. It's hard. Like my kid said to me one day, Mom, you're stupid. You can't really be a drug addict and get away with it. Because there's a lot of manipulation and lies and pretending that goes on. And when I worked in the detox, I'd bring my tapping with me. We'd do classes once a week. And one of the biggest themes that they wanted to work on was regret and remorse. All the things that they did. And they had to learn how to forgive themselves and move on, which they couldn't do because all they've had is bashing all their adult life, people putting them down and calling them names. And so trying to get them to relieve, to let go of some of that emotional component and then layer in self-compassion. You can't tell a person to have self-compassion if they hate themselves. So that's a 2-part process with tapping. It's saying the truth, speaking the truth. Women who look in the mirror and say, I hate the way I look. You're not going to walk around and say, well, I really like the way I look. No, you don't, you're lying. So you have to get to the truth. And you start to bring that up. And then that energy, so if you think of emotions as energy in motion, you're just pulling that energy and you're releasing it out rather than stuffing it in, because those unresolved emotions are going to get you one way or the other.
Now, there might be some naysayers out there, one of whom is a friend of mine, that says, this is a lot of malarkey. Is there any science or proof to show that these emotions are locked inside us?
Yeah, I mean, ask someone. How does it feel when you don't talk about this or that? Ask them.
Well, it also implies that
How do you measure that?
there's a certain self-awareness that one would probably have to have in order to pursue
And
some
that's-
of these techniques, right?
Well, yes, and some people just come out of curiosity. I don't know what I'm getting into, but my mother wants me here. We had a great couple of sessions this past week with people who, 38-year-old guys, just young guys, who had no idea what they were getting into, but mom wanted them there. And they walked out. The mother called me this morning. She goes, he wants to come back.
That's great. Hey, can you introduce us to your little yellow friend here?
I can. Let's see if it will work just with you and me. Okay. So this is a chirping chick. It has a battery in it.
Mm-hmm.
Anything that's, if the battery was dead, it wouldn't work. So, we got to remember, we're powered up with some sort of source, electrical source. When you're on life support and it's time to pull the plug, what are they pulling the plug to? Electrical outlet, that's it. So once we're dead, once our physical body is dead and we're re-released into the spiritual realm, we have electricity running through us. So this is a little demo. I don't know if anyone could join us.
Probably not.
Okay, so we'll have to do it ourselves, or I'll just tell you how it goes. Little battery in there. If I put one finger on one circuit, one on the other, it chirps. I break that circuit. So when I do a group or a demonstration, I'll usually have 5-10 people all hold hands. We all hold hands together, and I'll have the person to my right just put their thumb. Okay, but I'm holding the hand of everybody, and everybody's holding hands. So the thing's chirping away, then I will break my hand and raise it up, and it will stop. And people will go, what? Yeah, because your electricity is running through you pretty fast. In a nanosecond, it's passing through all of us. So start thinking of yourself as energy, in the form of energy. So instead of saying, I have anxiety, why not say, I have anxious energy and I need to release it? I'm a fearful person. How about saying, well, I have fear energy. I'm afraid of something, but I'm going to release it. When you say the word I am, the subconscious mind, one of the secrets to manifesting what you want is visualization. You got to give that subconscious mind a picture of what you want.
Something to aspire to.
Just see it. See it. Athletes do this all the time. Shaun White, that great Olympian back in 2009, I think it was, or 11, I can't remember. He was a snowboarding champion. Unbelievable. And I saw him on an interview, and they said, how do you do that? He said, every night I close my eyes and practice. I ran for a while. I picked up running for another 7 years. And I would go to sleep at night. I would just visualize myself. The visualization. Visualization is very important, as is gratitude. Those two keys. Being grateful for what you have will invite more of the good stuff. Bitching about what you don't have, poor me, that victim mentality pushes everything away. This is a great book, Healing and Recovery, and it's all about calibrating the energetic levels, by David Hawkins, who's fabulous. Healing and Recovery. I was reading about, since we were going to be focusing on addiction, I went to the chapter on alcohol. And he was saying one of the greatest reasons that AA works for so many people is because when you think about the energies that come out of that 12-step program, you've got non-judgmentalism, everybody's welcome, no one's beating up on you, no one's shaming you, all right? You got a place to go, you have support, you have encouragement, it's got all the good stuff. So that vibration is what pulls people in. Now, is that the only way to get clean and sober? It's a good way, it's a great way, but some people want other ways, and there's a lot of other ways.
Yeah, speaking of that, so let's extend this idea a little bit further. If we do recognize that we are energetic beings, and we are, but we also have a soul that
Correct.
came from a higher power.
Correct, I believe
How
that.
might that affect the way in which we approach addiction counseling or treatment?
Well, again, going back to what is holism, I understand you're a body, mind, and a soul. I get that. I get your emotions. You're a one package deal. So how does it affect it? Some people, when they lighten up their emotions, they feel free. They feel like their soul is freed up. I feel like Now, this is a theory. Some people believe this. I think I kind of do. That when we came down here, we get condensed into these dense bodies, and our spirit has to deal with that. And I know a lot of people, you could probably say to yourself, oh, she's a free spirit. He's a free spirit. You know, they have that spirited piece to them. I think I am definitely one of those people who walk through life, except for my mother was afraid of me. She's like, all you talk about is what, your freedom? I'm like, yeah, it's true. But I really do think that life can be very difficult in these dense bodies. It can be difficult, it could be hard. It doesn't have to be, but for some people, as they get older, as they get more debilitated, or as they get sick, you could die a horrible death, or you could die a peaceful death. So it isn't the death, we're all going. Nobody gets out of here alive. And actually, there was a study. They had 2 rooms, and they had a very angry man who was dying. Angry. And they could measure his calibration of what he was. You know, vibration puts off a calibration. Just like a high C and a low C on a piano, whole different resonance. The woman was at peace, and she knew she was dying. And her vibration was so totally different than his. So what we're feeling, we're vibrational beings, we're electrical beings, but we also put out a vibration. You know, people that you have good vibrations, you kind of want to be around them because they uplift your spirit, but they're not pompous or arrogant, they're just nice people.
Good energy.
Good energy, you want to be around that, right? And then you get the downers, and who wants to be, oh God, all she does is complain. So, you know, people give off, whether they're talking or not, you're giving off a vibration.
I think this is all very good news, and for a lot of people, this might be new. But the other thing that's important to get out there is that, you know, we really just talked about, you know, a general approach to looking at getting healthier emotionally, which can lead to making it easier to resolve addictions and other kinds of unhealthy behaviors. But you might have seen the 60 Minutes last month. It was pretty amazing. They had a segment on the effects of psilocybin on several different kinds of patients. One was a lung disease diagnosis. It was terminal. And the other 2 were addictions. Nicotine, a woman smoking for 45 years. And then the third person, an alcoholic who drank incredible amounts of alcohol every night. So they participated in a study, I believe, in Johns Hopkins, taking a clinical dose of psilocybin. And the resolutions of those addictions were immediate. And those 2 people that were profiled that had addictions never had a desire again to drink or to smoke.
Great.
So there's a lot of wonderful remedies out there, right? Yeah. There's even homeopathic remedies.
Which I have to tell you, I don't know that much about.
But there's a lot of neat things here that people should know about, right?
Right, definitely.
So how can we find out more about these remedies? How do people determine where to go? Can they just, you know, talk to people like you, or how do they find you?
I mean, as far as being directed to a homeopathic remedy, I'm not the person to do it. But you know, we have an internet now, which is ask Dr. Google. I mean, you can Google these. You were telling me about that psilocybin, and even up until last night, I was trying to find that 60-minute episode, but I don't subscribe to that channel, so I couldn't access it. But then I Googled it, and I read the pros and the cons. There's people get frightened too. I mean, I grew up in the 70s, and drugs were rampant, pot and all that stuff, but that LSD piece never really pulled me in. Because I saw people jumping out windows thinking they could fly. I was a nurse at the time. Right. And I just didn't want any part of that.
Well, we're going to sign off shortly. There's so many other things we could have talked about today, Tina. Did you have anything else you want to add or qualify to what we discussed?
There's a lot, but just understand that if you're having a hard time breaking a pattern or an addiction, you got to work with your subconscious mind. Don't try to squat it out. You have to, and the reason I think it's good to get a practitioner to help you with that, because there's a lot of books and hey, how to tap, and that's what people will do. They'll read a book, but they don't really know how to do it. So there's EFT practitioner directories. I'm on several of them. I'm easy to find, and I'd be happy to help you. I still do that practice and my job. So,
Tina, thanks for your time today, and thanks so much for helping so many people.
You're welcome. Pleasure.